Just as bad.
We want to say good morning to our dermatologist, Dr. Andrew Ford. And the subject today is melasma.
Melasma. That's another
Melasma.
easy word.
That's a nice
keep,
name.
keep them coming. Melasma. Yeah. What in God's name is melasma?
Melasma has a Greek origin and it just means brown skin. It's
Oh.
also it's also
Melasma
used.
means me.
Yeah.
Yeah. Well, cloasma, a mask of pregnancy, are other names given for it, but it refers to a discoloration that occurs mostly on the face, but it can also occur on the body as well, and it's predominantly an affliction of women.
So this is where the face goes lighter and the neck gets darker, or can it be
No,
the
no.
opposite
Well, we
way?
did something last week about that, acanthosis nigricans. But in this case, you have a deposition of pigment in the curvatures of the face, and it can occur in many different patterns. The centrofacial is the most common one, and this is the forehead being a big part of that. You see these brown patches, which can coalesce to form larger areas, macules which can coalesce, and you notice it concentrated on the curves of the face. So the forehead, the cheeks, above the lip especially, and also sometimes on the jawline. So this one, it gives you a close-up of the cheek, so you can see the brown macules just being together. And if you think about it, you've seen a lot of people with
Yeah,
this
you have.
condition, especially women. But that doesn't mean that it can't occur in men. About 10% of patients are men. And this is a different coloration in a patient with a lighter skin tone. But it's a very familiar and common affliction, especially in our climate.
Does it have any pain, or how
No,
serious is it?
there's no pain or discomfort or itching associated at all. It's just asymptomatic. I think the only pain is psychological because it does cause a lot of concern trying to get rid of it or to cover it up.
But sometimes, can you mistake it, for freckles?
Yes, certainly freckles can be mistaken for it. We also did a condition earlier called lichen planus, and also
Yes.
some medications that you take can cause discolorations of the face, or things that cause inflammatory changes can cause darkening. We talked about earlier about people who use hydroquinone and get darkening as well. So there are lots of other things that can mimic melasma.
Why only above the neck?
Well, it can occur below the neck as well. You can have it on the arms and also on the upper back and chest. It has a lot to do with the sun exposure. The sun is the biggest factor which causes melasma, sun exposure and sun damage. This shows another pattern which involves a malar area. We talked about lupus and other rashes that affect the nose and the cheeks, and this is another one of the patterns, which is the malar melasma pattern.
It looks similar to something you often see on the legs near the shin bone. Is that similar? Do you know what I mean?
Well, we did show something last week, the lichen aureus last week, which was a pigment.
Where was I last week?
I'm not sure where you were, but that was just a variation last week, some pigment being deposited from red blood cells. But the thing is, with the skin, lots of conditions give you discolorations, which can be darker or lighter. But this is to highlight a very common and naturally occurring form that predominantly affects the face.
Okay.
And we're checking to see if you have
You're
it, but
looking?
no signs of it.
I
But
don't
lots
think
of
so.
people have it and just cover it up with makeup, so it's very common. Some people that you see on TV, not necessarily in this room, of course, do have it.
Oh, okay.
Yeah.
Yes,
Okay.
this is just to show that guys can get it too. You see an older gentleman there, and mostly his forehead is a mottled discoloration and pigmentation there.
Is this genetic?
Well, it can be. There is some genetic predisposition because you can see it sometimes in family members a lot more than others. But generally, it has to do with the sun, and also in the female, you have the hormones. So remember, it's also called the mask of pregnancy. So there's some women who, when they're pregnant, they manifest the condition. And once they deliver and as time goes on, they don't have it. There are others who are on the contraceptive pill or have an intrauterine device which has hormones in it, and that can make a difference too. So the sun and hormones are big players, but the fact that men have it shows you that the sun is the factor.
Does SPF, the sun protection, help to stave that off then?
Well, definitely that's one of the parts of the treatment, the general measures that you use to prevent melasma. You have to avoid the sun. Of course, it's clothing, hats, high SPF factors, and in areas where you have the climatic changes, it can be a problem that occurs mostly in the summertime. But here it's always summer, so this is a place where you'd have it a lot more.
What factor do you recommend? I just want to
Well,
know.
you have to go above 30. 30 is a minimum. Many years ago it was 15, but 30. But
if I
the,
could
the
find
factor is
110.
over a certain number. I don't think there's a good representation of the number. It's more marketing than anything else. I think 60 or so would be, you know, the
Ideal
most
for our
efficient.
son.
Yes, definitely.
Okay. I found a 110 once. It was awesome. It was awesome to
It felt
find
good?
that. And
Yeah.
it was light but effective. So let's talk about application then, because sometimes people will put it on and go about their business, maybe even running and whatever, and don't think they need to reapply. So
Well, reapplication in our environment is very important, especially if you're outdoors or in wet conditions at the beach or the pool. Reapplication every 2 hours will be necessary, and also the type of sunblock that you use. There's sunblocks that can block UVA, UVB, and also there's some that are physical, which have colorations as well. But the sun exposure, stopping hormones, and also trying to treat the condition is important. And treatments involve topical as well as sometimes using various machines to get rid of the discolorations.
Okay.
But in some cases, you have to use camouflage because sometimes it's important to get your skin color matched and just to use something to cover it up. And also that can physically protect you from the sun as well while the treatment process continues.
Oh, the old-fashioned broad rim hat, is that a good?
Yes, it's broad rim hats are great, especially now if you're outdoors. Sunblocks only slow down the effects of the sun, but the sun is always acting, and it's just you're trying to slow it down with the sunblock. But a sunblock doesn't give you, doesn't allow you to just be in the sun and do as you like. And still between 11 and 3, they're the times when the sun is at its most intense.
hottest. Okay, so really protect yourself, and an umbrella or a
Yeah,
parasol,
umbrella.
whatever you call it, that
In the
is
shade.
helpful too.
Yeah, and you have to realize that lots of the sun's rays are reflected off of glasses and panes of glass and all sorts of physical structures. And when you're in the sea, you can still be affected by the sun.
Excellent, and it's not contagious, melasma.
It's not contagious, but this is one of the conditions that's treated with lots of things that can bleach that are hydroquinone based, but usually best done under the guidance of the doctor. Also, since you can have the pigment deposited in the surface or deeper, for cases where you have the epidermal type, peeling agents work very well. So
Okay.
things that have tretinoin or other types of acids and combinations of those help. Lasers are also used, and it's a condition that's controlled more than cured.
Okay,
So, the bottom line is stay out of the sun if you can avoid
or
it,
protect yourself.
or protect yourself.
Excellent. Thank you very much, Dr. Ford, Dr. Andrew Ford, our dermatologist, telling you about melasma and realizing it's common, more so in women, but it can also happen with men. So do what you need to do and protect your skin wherever possible. We'll be right